I'm Neeraj Chavan, and I'm from Mumbai, India, and I was pursuing my master's in public health here at the Harvard School of Public Health, concentrating in family and community health. And what I was really interested in was its community-based approach, the whole community outreach and community involvement factor, which is very crucial to a developing country setting like in India, and which is exactly why I wanted this concentration and this program here in Harvard. I would definitely want to go back and work in the urban slum setting in Mumbai, but I'm before that trying to think of capitalizing my resources in any other developing country setting, and then taking those lessons learned and applying them to Indian settings.
I'm Dr. Padma Chavan. I'm from Mumbai, India. I'm a professor in a medical school in India, in Mumbai. And Harvard, being an academician, Harvard means a lot to me. So it's a great feeling to be here and sharing this moment of graduation with my son.
I'm Speciosa Wandira Kazibwe. I'm from Uganda, and I just graduated with a Doctor of Science degree in Global Health and Population. Before I came here, I was Vice President of my country, and I retired or resigned so that I could fill in the gaps that I had found when I was making policy for my country. And I found that the knowledge and exposure I have got in this university, and specifically in this School of Public Health, has widened my horizon beyond looking at public health as chasing diseases. Now, I know that when I go back to my country as a policymaker, I'm going to concentrate on making people healthy. That is what I have learned in this school. Poverty and health are, they move together. They are inversely related. So if you are very poor, then you can't purchase health, you can't purchase knowledge, your children don't go to school. So I'm going to use my position as a presidential advisor on microfinance to introduce financial instruments that will enable my poor country, get people to participate in making them more healthy.
The core of the public health challenge, I think, is that the complexity of the world has just exploded. The complexity of what it is to keep people healthy and then to treat them when they're sick has made our systems almost unmanageable. We went from mainly dealing with infectious diseases as our focus for poor communities especially, to now still needing to solve our infectious disease problems, but now we have diabetes, cardiac disease as top killers in Asia, in Latin America, in sub-Saharan Africa. We have road traffic accidents and surgical trauma. We have the need for surgical care for women who need emergency C-sections. And then in other parts of the world, all of those costs just stripping their government budgets to the point they can't get other things done. And so, if anything, the work of public health is in the center of all of our struggles right now as societies and just how we live our lives as human beings. And my sense is that people are turning to people with skills in public health, which really just means the ability to reach across many disciplines to help solve problems in the world. And people are turning to them desperately.
So my name is Nadeem Al-Duwaj. I'm in the MPH Global Health Program. I think one of the strengths of HSPH among many is the sort of the cultural mix and the heterogeneity of the student body, as well as the faculty, which I think is unique. And specifically in the area of interest that I feel very close to, the area of health policy and management, as well as international health, we really have the leaders here. It was very truthfully the most revealing and the most significant experience that I've had in terms of my medical career. This Master of Public Health for me was an eye-opener, and it completely changed my perspective on healthcare and health systems. I'll be going back, at least for the summer, to Kuwait. We're working on establishing a health policy think tank for the region. That's sort of my big project.
So my name's Clare Barnett. I'm from Melbourne, Australia, and I've just finished an MPH in Global Health and Population. So I'm going to be working in Botswana with the Harvard HIV/AIDS initiative. doing some of their clinical trials work with paediatric patients with HIV in Botswana. I think for me the amazing thing about being here has been just the wealth of people from different backgrounds and different places around the world, and really the diversity of people. It's just been really great that every class that you go to there's a different mix of people and a different, you know, aspect to learn from, and everyone comes with such unique experiences, and that's really made being here a wonderful experience.
So I'm Travis Johnson, and my degree is a Master's of Public Health in Global Health. One of the things I did at our residency program was work with Honduras with a group called Shoulder to Shoulder, and I started a child health initiative in Honduras in a small little town called Santa Lucia. And what we've done here is to kind of learn more about using epidemiology, biostatistics, program management, program development that can probably better make our system more efficient, enable us to really ask the right questions, know what questions to ask, and also to kind of be more creative. So after this we're going to be moving to Bundibugyo, Uganda. So it's with a small group called World Harvest Mission. So similar to what I was doing in Honduras, but we're going to kind of take it into a little bit larger scale in the middle of Africa. In that area, child mortality is still about 1 in 7 children die before the age of 5. And lots of HIV, malaria, malnutrition. So developing malnutrition projects, working clinical medicine, working in an inpatient hospital setting, and really developing whatever projects we can to help the kids.
That's fantastic. Are you going with your family? Or?
Yeah. Lily, where are we going to be going?
Your years at the Harvard School of Public Health and your continued association with it will give you the capacity to turn your ambitions into reality. For it is you, the next generation of public health leaders, where the hope for a better future lies. I salute all of you on your accomplishments to date and look forward to the full deployment of your talents for the betterment of our common human experience. Congratulations.